Good evening, everyone, and welcome to the meeting for the Council of Town of Petawawa. I'd like to call this meeting to order for March 2nd, 2026. For the Council for the Town of Petawawa. Welcome to members of Council, staff, and our special guests here with us this evening. Start this meeting off with the reading of the land acknowledgement, and this evening it's Deputy Mayor Simon.
As we gather this evening, I would like to acknowledge on behalf of Petawawa Town Council and our community that we are meeting on the traditional territory of the Omama Winini Algonquin people. We would like to thank the Omama Winini people and express our respect and support for their rich history. And we are extremely grateful for their many and continued displays of friendship. We also thank all the generations of people who have taken care of this land for thousands of years. And we wish to acknowledge our shared responsibilities in responding to the Truth and Reconciliation Commission 94 calls to action. Call to action number 88. We call upon all levels of government to take action to ensure long-term Aboriginal athlete development and growth, and continued support for the North American Indigenous Games, including funding to host the Games and for provincial and territorial team preparation and travel. Recent progress. Budget 2022 announced $20 million in renewed funding over 5 years for Indigenous youth and sport, including the continued support of the North American Indigenous Games team preparation and travel through bilateral agreements.
Thank you. And now I'd ask if everybody in attendance would please join me in rising for a moment of silent reflection. Thank you very much. I need a motion to approve this evening's agenda. Moved by Councillor Roos, second by Councillor Donovan, that the agenda for March 2nd, 2026, regular meeting council be adopted as presented. I'll call for the vote. All in favor? It's carried. Are there any disclosures of pecuniary interest on any of these matters? We have some minutes to approve for the council meeting of February 17th, 2026. I need a motion to approve those minutes. Moved by Councillor Coutu, seconded by Deputy Mayor Sabrin, that the minutes of the regular meeting of council held February 17, 2026 be approved as printed and circulated. Any questions, concerns? I'll call for the vote. All in favor? It's carried. And now to the highlight of the evening. We have with us Judy Hill, the Executive Director of the Petawawa Centennial Family Health Center, and Paul Morrow, Board Chair for the Health Center as well. They're here this evening to talk about, well, really to give us an update, but innovations in Renfrew County, a hybrid approach, combining in-person and virtual care options to improve equity and increase access to care. And joining them as well is Dr. Jonathan Fitzsimon, the medical lead, and he is joining us virtually. Good evening, Dr. Fitzsimon.
Good evening.
And I'll turn it over now to Paul Morrow to introduce the entire team.
Great. Thank you, Mr. Mayor and members of council and staff. Thank you very much for having us tonight. It's a fantastic opportunity for us to come and talk to you in terms of leaders in our community about what we've been up to at the Petawawa Centennial Family Health Center. I think we made some real progress over the last couple of years. You know, we've talked to His Worship several times about how our model of care has changed. We've had some challenges with doctor recruitment over the years, and we've responded to that. And I think we've been very successful, especially with Dr. Fitzsimon's help. So Dr. Fitzsimon is our medical lead on VTAC and IVC, integrated virtual care, and it's evolving to a hybrid model of care. And Jonathan's going to talk more about that and give council some details on that. So Jonathan's here with us today. I think everyone knows Judy Hill as well, and Judy's our executive director, who's been with us now since 2014. Am I right?
Yep.
So
That's
just
the ED.
2008.
2008. So I'm not sure council is aware, but we are going through a process to replace Judy because Judy has decided to retire. So hats off to Judy and thank you very much for your service. You've done a fantastic job for us leading us over the last 12 years, I guess, as the executive director. So well done, and we appreciate everything that Judy's done for our community. So that's terrific. Behind me, I have Rick McNiff, and Rick is our latest recruit to our board. And Rick, I think council probably knows Rick. He's the owner of Doghouse Breweries, and he's now going to play a role on our board of directors. So we have a group of folks, so every council's aware. Tom Mones, Shelley Wade Clark, now Rick, and Keith is with us as well. And Keith is a retiree from Atomic Energy of Canada. Every board does require a nuclear engineer to sit at the table. So Rick, we've got that box checked. And we have another person, Bernie Rusin, who is the IT specialist retired from Regional Hospital. So he gets the whole health sector IT stuff. And then on our board, we also have Daphne Gebhardt Turcotte, and she's our communications kind of specialist. So we have a skills-based board that we help kind of guide the center, and that's our goal. So I think down the road, just so council's aware, we're going to continue to try to renew our board and get some more folks around the table, but it'll take a little bit of time to get there, I think. So with that, I think I'm going to turn it over to Judy and John. So unless our other folks have anything to add? Okay, thank you. Appreciate you allowing us to come talk tonight.
Thanks, Paul, and thank you, Mayor, for the opportunity to come back and talk to you. And if I may, I would just also like to add my appreciation to Paul's comments about Judy. What I'm about to present with you, I've been working on over the last 6 years, and absolutely couldn't have done it without Judy's help and influence and hard work. Next slide, please. And if you just click next one more time, we can put all the bullet points up together. So a little sort of refresh as to where everything is situated about what I'm going to talk about. It's important to reflect on the fact that Renfrew County is the largest geographic county in the province. There are 5 community hospitals, each with an emergency department. But the data and the evidence is very clear that the population on average across the county is older, is poorer, and has higher levels of chronic disease than the provincial averages. And of course, there are no walk-in clinics and no urgent care centres. It's the emergency departments or it's family practice, so it's attachment to a family doctor or nurse practitioner. And historically, Renfrew County has had some of the highest rates of unattachment where residents do not have access to primary care. And this leads to an inevitable over-reliance on use of emergency departments for care that would be better treated in primary care. Next slide, please. And so it leads to an important question. Why do we need primary care? What is it that's so important about primary care? And then perhaps the so what, what's the impact of not having a family doctor? And so one of my roles is to do research on this topic. It's to provide the evidence base as to why we need the programs and the services like VTAC and integrated virtual care that we've been developing and implementing over the last few years across the county. And we've published 2 papers in particular that really delved into the impact of not having a family doctor. And I think the way I present it is that it's important to look at it from multiple perspectives. From the patient's perspective, not having a family doctor increases your risk of dying. If you have chronic conditions, multiple chronic conditions, you're twice as likely to die in the next year if you do not have a family doctor compared to someone with the same amount of chronic conditions who does have attachment to a family doctor. And, you know, mortality, death, it doesn't get much more patient-centric and outcomes that are important to patients than that. But we also know that it increases the chances that you'll be admitted to the hospital, that you'll attend an emergency department, and that you'll cost more dollars to the healthcare system overall. And we were able to quantify that, again, with multiple chronic conditions. Somebody with a family doctor will cost the system about $3,700 a year. Same person with the same sort of level of chronic disease without a family doctor, total healthcare costs over $8,000 a year, more than double. So whether you're a patient, whether you're running a hospital, or whether you're a politician who's trying to balance the healthcare budget, primary care has a huge impact on all of those sort of angles. And I think it was, you know, it was really telling that when we just recently published the second paper that that emphasised that impact of mortality association, that it was really caught by the media and ended up on the front page of the Toronto Star. I think it's the only time in my life that I'll have any of my association with Olympic gold medal winning skaters, but there you go. Next slide, please. So what do we mean when we talk about a hybrid approach? Well, first off, there are two key components as to what defines what I've started to term as a hybrid approach. And the first element is that we leverage pockets of capacity in the existing workforce. So there is a shortage of family doctors, no doubt about it. I'm not trying to deny that. But there are also areas of Ontario where there are sufficient family doctors, indeed an excess of family doctor capacity. And so a hybrid approach enables the leverage of those pockets of underutilized capacity and bring it to communities which are historically hard to serve. And then the second key component is that we blend virtual care with in-person care locally. So it's not just a in-person only in a bricks and mortar clinic, and it's not just virtual only, a sort of telephone fire and forget appointment. It's really important to emphasize that blended mix of both virtual and in-person care options. And we've done some in-depth evaluation over the last 6 years of a hybrid approach to urgent care, you know, which in Renfrew County is the VTAC service, and also the hybrid approach to attachment to comprehensive team-based care. So that's the integrated virtual care that Paul mentioned, which is based in the Petawawa Centennial Family Health Centre. We do actually now have 2 satellite sites, one in Deep River and one in one of the family health teams in Pembroke. But it's Judy is the administrative lead, so it's housed in Petawawa, and that's where most of the doctors and patients have this hybrid approach to attachment. Next slide, please. So like I say, VTAC is the hybrid approach to urgent care, giving people access to a family doctor. Okay, it's short of attachment. It doesn't mean that somebody now has a family doctor, but at least there's an alternative to either going to the emergency department or simply foregoing healthcare. And I think most people across the county are quite familiar with VTAC now. It's been up and running since the very beginning of the COVID pandemic. It was set up in response to the pandemic, and it essentially offers same next day urgent appointments with a family doctor, initially by telephone, with the option to switch to video if needed. And crucially, coordinating and collaborating with community paramedics who work for VTAC so that there are in-person sort of care options available to those physicians on the phone. And it is predominantly on the phone that most of the care is offered. So that we're not left with the only option of, oh, well, you need to be seen in person, so you'll have to go to the emergency department. There is this other option where we say, well, you need some additional examination, or I need someone to help me with part of this examination. So we have a number of assessment centres across the county where a paramedic is based. And we do actually on a few days each week have a physician available, so that our doctors working remotely, and we're tapping into a pool of doctors mostly in Toronto based. But if those doctors say, you know what, I do need a doctor to examine you, it's perhaps above the capacity of a paramedic, but it's not super urgent. You don't have to go to emergency department. So we'll book you in with one of the clinics with one of our doctors at a VTAC clinic later this week or early next week. Next slide, please. So you can see just the scale of the impact that that VTAC has had in Renfrew County. Over half of the residents of Renfrew County have now had care in one way or another from VTAC. And 57,000, in fact, it won't be too long before up to 2/3 of the county have had care from VTAC. And that's over 200,000 family doctor appointments since the start of the pandemic. And as I say, supported by paramedics, over 13,000 paramedic only appointments. So the paramedics just deal with the issue by themselves. And then another 8,500 where the paramedics can call on one of the VTAC doctors in real time to sort of join the assessment either by phone or by video. So it becomes this joint sort of real time paramedic family doctor assessment of the patient. And if you look at sort of the last 12 months or certainly 2025, you know, the number of appointments is now over 40,000 in the year. 6,200 calls is actually per month, so averaging around 6,200 calls per month. So our medical receptionists do a great job of helping people directly, sometimes diverting them to other resources that are available in the county. And they're able to help. About 1/3 of the calls don't even make it through to an appointment because our reception triage staff can help the patient. But 40,000 physician appointments just in 2025. And importantly, over 2/3 of those, almost 70%, are for patients who are unattached. They don't have a regular family doctor or nurse practitioner. And about 70% say that without VTAC, they probably would have gone to one of the emergency departments. Very few patients, when they get through to one of our doctors, end up getting advice to go to the emergency department, less than 3%. And so in 2025 alone, we estimate that we prevented over 30,000 unnecessary attendances at the emergency departments. And certainly if you speak to Sabine Mersman at PRH, you know, she said the CTAS 4 and 5, so they're those lower acuity cases, essentially fell off a cliff, you know, at Pembroke Hospital. They just don't have to deal with anything like as many of those low acuity conditions anymore because VTAC is picking up that task. So I'm going to hand over to Judy now, and she's going to pick up for the hybrid approach to attachment. So next slide, and over to you, Judy.
Thank you. So we continue with the hybrid approach with integrated virtual care, and that is attachment to comprehensive team-based care. We call it IVC. The hybrid approach, as I said, is comprehensive team-based care, IVC. We have attached 6,900 permanently attached patients to a family doctor. We've had 53,000 patient visits with either a doc or an NP. IHPs, or interdisciplinary health providers, provide backup support up to about 17,000 visits per year. I think it's very impressive to note the prevention screenings on the left-hand side. The number of cervical cancer screens, colorectal cancer screening, and breast cancer screening, and the number of smoking cessation referrals are up there as well. So IVC is delivering comprehensive team-based primary care with family physician leadership to unattached patients. This hybrid approach is supported by evidence. It's peer-reviewed evidence, and it's based on the quintuple aim framework, widely recognized for the program evaluation. So you can see that particularly Jonathan has been terribly busy with research. And on your slide deck, you're able to click on these articles that have been published in peer-reviewed journals. And Jonathan, I just have a paragraph or two to say before you carry on. Dr. Jane Philpott's program, Attaching Every Ontario Resident to a Primary Care Provider by 2029, came with Ministry of Health funding. At PCFHC, 2 full-time physicians, 1 full-time social worker, and a 0.5 full-time equivalent bookkeeper. 2 of the outcome measures that are being tracked are the number of patients that are attached to a clinical provider and the number of patients that are attached to a clinical provider from Healthcare Connect waitlist. Petawawa has transitioned from the highest unattached rate in the Ottawa Valley OHT to the lowest unattached rate. Essentially, as of January the 1st, 2025, there were no patients remaining on Healthcare Connect. In large part, this success can be attributed to our IBC program. But secondly, we have recruited 3 full-time physicians in a year and a half. Our present status is 19 physicians, 5 NPs caring for 10,000 plus patients. These clinicians are fully supported by a team of interdisciplinary health providers, such as a social worker, dietitian, pharmacist, midwife, respiratory therapist, nursing, and of course, admin resources. And lastly, when 2 area physicians closed their medical practices, one in Deep River and one in Pembroke, the PCFHC absorbed 800 Petawawa residents who otherwise would have been orphaned, which means not attached to a primary care provider. And this demonstrates ownership of our community responsibility. Drum roll to you, Jonathan.
Thanks, Judy. And so I thought I'd just take the last minute or so to share with you our most recent iteration of the hybrid approach, and it's what we're calling supported attachment. So if you think, I explained how many people with chronic conditions are unattached, they don't have a family doctor or nurse practitioner. As some of that money and the funding that Judy mentioned starts to sort of come on board to the teams, and other teams across the county are able to recruit new doctors and new nurse practitioners, there is a sense of that's fantastic that we have that pipeline of people coming in, but it may take several years. 2029 is the sort of provincial target, and there are people for whom the need is more urgent. 2029 is still several years away, and if you have multiple chronic conditions and no family doctor, that's a long time to wait. And then the other side of that coin is that the doctors and nurse practitioners, as they come in, if we then immediately sort of load those clinicians with a practice full of clinically complex, multi-morbid patients with a long list of needs and care requirements immediately, we risk burning those new clinicians out and the whole unattachment cycle starting again. And so what we're offering is using the hybrid approach, so tapping into pockets of underutilized clinician workforce across the province, blending virtual with local in-person care options, and then providing a sort of intensive period of onboarding where we get that patient's medical chart up to speed, we track their medications, we give them a meeting with a pharmacist, and then we actually give them a designated VTAC physician. So rather than just calling and speaking to the next available VTAC doctor, they can actually have some more intensive care from a designated VTAC physician. The idea being that over 3 to 6 months, ideally, we'll do this sort of bridging support so that they're ready to transition across to one of the new local doctors or nurse practitioners that will be coming to the county later this year. And it takes some of the pressure off that new clinician when they start their practice, that some of the work has already been done for that patient. So that's ongoing now. We're close to 200 patients that are receiving that level of intensive care and bridging support now. We've even had the first 5 that have completed the program, if you like. So they have already been taken on now by one of the doctors in one of the Pembroke teams, where they've been able to create a bit more capacity. And we'll be taking on all of the remaining Healthcare Connect complex patients from the Pembroke region. As Judy said, Petawawa's complex Healthcare Connect patients have been cleared now, but we'll be sort of helping those in the Pembroke area and providing a new sort of development of the hybrid approach, this time to supported attachment. So that wraps up our presentation. I hope it provided you with some good background information and an update of the numbers. And Judy and Paul and I would be happy to take any questions that anyone has.
Well, thank you very much, Dr. Fitzsimon and Judy and Paul, for bringing us all this information. And we had no idea you're going to drop this retirement bombshell on us this evening. We would have made a cake or had some balloons or something.
We can still do that.
I guess now we have more time to plan. So yeah, thanks for everything you've done for the Petawawa Centennial Family Health Center, and good luck as you transition away from the working world and into full-time relaxation.
Thank you.
And congratulations, Dr. Fitzsimon, on all of your research and the papers you've written. Front page of the Toronto Star, that's a pretty big deal. But that's not all you've done. As we've seen, there's lots of research that's gone into looking at these hybrid approaches, and everybody is listening. Renfrew County is a beacon of innovation in terms of healthcare. So it's great that you guys are breaking this ground. Congratulations to everybody there and all of your innovative ideas, RCVTAC, IVC, and the stats are astounding that, you know, all those 32,000 emergency department visits avoided because of all of these programs that we have. And if you ever talk to the CEOs of the Pembroke Hospital, Deep River Hospital, they will tell you that it's been noticeable. And that's helping at all levels of healthcare. The IVC, as we know, Petawawa is a very transient community. Every year, not as much as it used to be, but every year there's new families moving into our community from all over Canada, which means many of them are now suddenly unattached to physicians. So it's great that we have this program. Great to hear that you've recruited 3 new doctors recently and taking on all kinds of patients. It's just fantastic for our community. And I have to say, I have a family doctor, but I have used RCVTAC just because, you know, appointments weren't available or it was a holiday or for whatever reason. The administration of it is so efficient and seamless from the time you call and until you get into your appointment. And usually it is the next day. The paramedics are fantastic. And if needed, you get hooked up with a video or a phone call with an actual physician. So it's an amazing system, and it's been born out of necessity. It's all we can do. And it's great that you guys are on the forefront of this. Okay, I'll open it up to questions from Councilor Roots.
Thank you, Mr. Mayor. Judy, congratulations, and thank you for your dedication. It's been just wonderful having you part of everything. Paul, good to see you again, and Dr. Fitzsimon, thank you for all the good work. It's just more of a comment. I really like the hybrid approach, and just great work by the whole team and the new people that you have coming in, and the thought process about expanding the board and everything. I'm all for this, but very good work for our community. I hear lots of good positive things as well. So just a comment. Thank you so much. Thank you, Mr. Mayor.
Councilor Dunn.
Thank you, Mr. Mayor, and thank you for the presentation and congratulations, Judy. You're gonna love retirees. It's the best. I just wanted to comment that I've had the opportunity to discuss healthcare with peers and colleagues throughout Ontario, and I've always taken great pride in being able to pass on the information that's going on here in Renfrew County. I was orphaned a year ago from my doctor in Deep River. So I went the normal method of pressurizing my mother's doctor to take me on. And a week after that, I received a phone call for an intake process at here in Petawawa. So it was very welcomed, it was very comforting, and it was very successful. It was a great introduction to the services that are there, and to feel that connection has been made. So thank you very much.
Councilor Kramer.
Thank you, Mayor Service. And not a question, just more comments. Congratulations, Judy. You must be looking forward to that. Dan too. But thank you for bringing this presentation to us tonight and describing all of the innovative strategies that you've been using to provide the top shelf healthcare that we've seen come out of this facility. And thank you, Paul, for governance, Judy, management. Together, it seems to have worked spectacularly. So I hope that moving forward, we see the same results again. Thank you.
Deputy Mayor Savage.
Thank you, Mr. Mayor. Judy, yay for you in retirement. That is exciting. And I'm sure your grandkids are going to love it most of all. So I guess what I'm loving about this process, and thank you, Dr. Fitzsimon, as well. What I'm loving about this process is that you are utilizing the full scale of the skills and in the various wheelhouses of healthcare. And the fact that you can bring a paramedic in to help with an assessment, to be able to determine where people fit and things like that is a tremendous, I think, a tremendous benefit to people who are either in crisis or whatnot, because it's really about having that contact, about knowing that we're being directed and funneled forward, wherever that may be. And I look back in the years when I was privileged. I've always been privileged to have a doctor, and that's a very, very rare thing. I was privileged to have doctors mostly at the Petawawa Family Health Center. However, I'm at the I'm in Pembroke now, and I'm very grateful to that. What I do understand is that my needs are very basic, and I'm really grateful for those with the complex care needs, because you're extending the lives of people. You are giving them not only hope, but you're giving them concrete care to maximize their life and to maximize whatever it is that they need to. I've got like a ton of notes. So whatever it is that they need to be taken care of in terms, and especially I think in terms of just knowing that they've got the right person to listen to them, to care, and they're going in the right direction. So thank you very much for your innovation. And every time you come, I mean, my mouth doesn't hang open because I make sure that I keep it closed, but it's really quite awe-inspiring. So thank you so very much. And Dr. Fitzsimon, keep up the great research. Thank you.
Thank you. And
Absolutely.
I really hope the next time I talk to you, that nobody has to say that they feel like they're really privileged or lucky or fortunate to have primary care. It absolutely should be the expectation that everyone in our community is attached to a family doctor or nurse practitioner and can access primary care, high quality primary care. So I hope the next time we come, it's the norm rather than you feeling fortunate about that.
Okay, you made a good point, because when people move to Petawawa, they realize quickly we don't have a hospital. And I'd like to dispel a common misconception that they feel that everybody is a hospital or a medical center in the garrison and they take care of everybody. But it's only the actual military members that receive care up there. So all of their dependents are here looking for health care as well. Councillor Kutsu.
Thank you, Mayor Service. Thank you very much for your presentation today, and thank you very much for bringing all this innovation. What really blew me away was when you said that the Healthcare Connect waitlist was emptied, because I can remember many years ago when that wasn't the case. So to me, that's a huge milestone, and I really appreciate the way that you broke it down, where those tense points were and how you've gotten past it, and triaging people when they're calling and getting them connected with the care they need. And I think from what you showed me, I really get the sense that nobody's being dropped in our community. No one's needs are being ignored. When you call in, you are exactly that connected. So I can't thank you enough when I think about all the people, as Gary said, who move in and find themselves in a situation of having to find care now, sometimes complex care for their families. So I'm really comforted by the idea that we have this amazing, thriving system working to give people what they need. So I'll just say one more time, thank you for all your efforts, and enjoy your retirement, Judy. Well deserved.
Thank you.
Councillor Driscoll.
Thank you, Mr. Mayor. I'll just echo everybody else's comments of congratulations, Judy. I know it will be nice to retire. I hope to get there someday myself. Honestly, the numbers are actually pretty astounding. I didn't realize that 57,000 patients have been served in the county, which is pretty remarkable. And I think that with the like Gary was saying about the ER wait, or 35,000 people that are not going to ER visits, that alone in itself is worth it because everyone's been to the ER department. You go in there and you have to wait for 6-7 hours for something, but if we can eliminate that, it's very good. The one question I do have, actually, I really like that you got the 3 new doctors, but I know in the last few years recruiting has been hard. Is it starting to get easier? Are we trying new methods, or like, and how is like retention with them when they come? Because I mean, three in a year and a half is pretty good.
That's pretty darn.
Yeah.
No kidding.
So like, we're doing something right, so.
Well, the government brought out a Practice Ready Ontario program, which is international medical graduates. And in the fall of 2024, we had Hadi Namazi come from Iran. And he was supervised by Lindy Corrigan, our medical lead for in-house docs. And he remains there. Now we have a return of service with him for 4 years. And you're right. Will he settle down with roots, etc.? We'll have to wait to see. We had just a brilliant stroke of luck with Corbin Hart, who has family in the community, and he moved here, wasn't even aware of the type of model of care that we have at the PCFHC, the blended salary model of care. That's the kind of practice he wants to have. It's balanced work-life. He has fully supported by admin and IHPs. And we have May Ibrahim, who's starting tomorrow. Mm-hmm. And she's a pro doc from Iraq, actually.
Very good.
And I understand you may be a victim of your own success. Now that you've recruited all these new positions, you're running out of space.
We are running out of space.
Even if you wanted another one, where would you put them? So I don't want to put you on the spot here, but do you have a plan moving forward to expand, I guess, to make room for more?
Over to you, Paul. Yeah.
Well, with that, and again, my apologies at the outset, you know what, I tried to introduce all the board members. And I cannot believe I forgot about Tom. Tom Mones was the founding member of the health center, and he's been with us ever since the doors opened. I think it was back to 2007. So, you know, Tom has been a driver of growth. He brought me on, I think, in 2010, and we worked on that expansion back then together. So would the board contemplate another expansion? That's something that we would have to talk to the town about. The town owns some property adjacent to us. We do have some sewage issues in terms of what would need to occur on the property with respect to grade and drainage on the property to remove that. That's where we had to cut off the last piece of the last addition to the property. So we have some challenges there. So I guess what I'm saying is it's a board decision. We wouldn't rule it out, and we would most certainly have to work with the town on dealing with some issues should we want to expand the facilities. The room's there, just some engineering challenges.
We could probably find a good deal on land. We're really willing to expand. Is there such a thing as like a public-private model? Does that type of thing exist where private entities could come in and build what you need and lease it back, you take them?
To a certain degree, we have that in place. So with our last expansion of the health center, we have brought in private sector facilities that complement our existing operations. So, you know, we did have Mulva Hills in there, but we now have Life Labs.
Life Labs, Madawaska Valley Midwives, Nurture and Wellness Center.
So those are private facilities that complement our operation, and that allows us to generate a little bit of revenue. And again, our policies associated with that is the revenues need to be used to provide healthcare to the community. So some white lines on the road, if I could say it that way, on how we can use those funds.
Well, that's exciting. And Judy, I asked you earlier if you could mention perhaps, we always talk about it in here, the community assessment centers with the paramedics and how that's working. Perhaps you could comment on what we have in place now and what are the plans for that as well and how it's working.
Sure. In September of 24, we started with a half a day a week Mondays. At the end of that year, calendar year, we upped it to 1 day a week full for the full day. And now we're every second Friday as well. And the busyness of the clinics is increasing. And certainly the VTAC admin staff are referring people from Pembroke even up this way because we do have more availability.
Well, that's good to hear as well. And I know that maybe if anybody in here is called RCVTAC, that they'll ask you, is it Petawawa or Pembroke that you want to make you aware that you do have that option to stay here in Petawawa for the CAC. Any further questions or comments? Well, that's all very exciting news, and thanks again for all of your work and for providing our community with an innovative level of healthcare that we wouldn't have if it wasn't for you, your team, your staff, and all of the good ideas that you come up with. So thanks again.
Good. Thank you again for having.
Thank you.
Thanks.
Thanks, Jonathan.
Thank you.
Thanks, Dr. Fitzsimons.
Thanks, Jonathan.
Okay, we'll get down to the rest of our business. Thanks again.
Thank
We'll move right into bylaws. First up, we have bylaw 1814/26, being a bylaw to adopt estimates of all sums required for municipal water, wastewater purposes for the 2026 fiscal year. I need a motion for first and second reading. Moved by Councillor Cloutier, seconded by Councillor Roots, that bylaw 1814/26, being a bylaw to adopt estimates of all sums required for municipal water and wastewater purposes for the 2026 fiscal year, be read at first and second time. Are we calling for a recorded vote?
Maybe just on the third.
Okay, third.
The third reading.
I'll call for the vote. All those in favor? Opposed? It's carried.
Corporation of the Town of Petawawa, bylaw 1814/26, being a bylaw to adopt estimates of all sums required for municipal water and wastewater purposes for the 2026 fiscal year. Be read first and second time, the second day of March 2026.
I need a motion for third and final reading of bylaw 1814/26. Moved by Councillor Donovan, seconded by Deputy Mayor Sabrin, that bylaw 1814/26 be read a third and final time and pass. Are there any questions, comments on the bylaw? Councillor Kernan.
Thank you, Mayor Service. I'll request that this vote be recorded, please. And I will just explain my position in that I cannot support this budget because of the debt that we're incurring via this budget. I sat at this table for many years, 13 years running, where we had budgets which were balanced and not deficit financed. It is possible to do. I am not comfortable with the amount of debt that we're taking on. We're not only raising people's taxes, but we're reaching out into the future and taking money that they have not even made yet to spend on things that we want done. So for these reasons, I cannot support the budget.
Thank you. Deputy Mayor Sabrin.
Thank you, Mr. Mayor. In regards to Councillor Carmody's comments, I too am not thrilled with going into debt. We have, however, gone into debt in the past for a number of things that we felt were necessary and needed. And an example that comes to mind is the Ottawa Valley Waste Recovery Centre, where we went into a debt for a great number of years. Unfortunately, the reality is that costs have increased. The municipal infrastructure continues to be one of our greatest challenges going forward. And many years ago, undoubtedly didn't raise taxes enough to be able to accommodate for future needs. And that's an ongoing challenge, and it's a real balancing act. I'm not happy about going into debt, and I certainly, should I have the privilege of sitting around this council table in future years, will not use this as a way to carry out the requirements of the town. I think it could be a slippery slope. I'm comfortable with the debt that we have for a short period of time and paying it back because we do need to have a number of road projects completed and to keep our roads safe and to keep growing as a town. So I understand Councillor Carmby's position. I too have concerns. However, for this year, I am comfortable with where we're going. Thank you, Mr. Mayor.
Thank you. Further questions or comments? Councillor Driscoll.
Hey, Mr. Mayor, I'll just echo what we discussed in our budget day meeting. I can't support it based on debt. This town has been a beacon of efficiency with the money they've been given and from the taxpayer. And I'm concerned with the debt we are borrowing. I'm not opposed to debt in a general sense. When we built the public works building, we're building the infrastructure piece that is going to last a long time. And yes, a road will last a long time, or a truck can last. But it's different when you manage your own money. Everyone gets in a mortgage, you buy a house. But if you finance every single thing else, every renovation on your house, you'll never get out of debt. And right now we're financing roads projects that will continuously have to be redone. So for that reason, I cannot support it because we are financing for roads projects. I said the same thing when we did Wolf. I don't agree with it. If we come to, and we do have future on the horizon. We've talked about water plant, we've talked to new fire hall, we've talked upgrades to the civic center. These are big ticket items that will undoubtedly cause more debt. So for me to support a roads project and a vehicle, I can't get behind that. So thank you.
Thank you. Further questions or comments? Councillor Coutu.
Thank you, Mayor Service. I'll just say my perspective on this. We can't stop all programs and activities in the town because more Road needs work, and we can't raise taxes by 39% because more Road needs work, and we can't ignore needed upgrades to important infrastructure. So to me, debt financing creates that situation where you can meet current needs and future generations pay their share. That, along with a reasonable tax increase, especially where, as Deputy Mayor pointed out, taxes have been historically low. This is responsible. So this spreads the burden of building and maintaining a viable town. And it doesn't ignore our responsibilities to build for the future. So to me, this budget reflects our priorities, our plans, as outlined in countless documents that we have discussed and looked over. And honestly, staff have prepared this budget thoughtfully. We've considered it thoughtfully, and I can support it. Thank you.
Thank you. Further questions or comments? Councillor Roots.
Thank you, Mr. Mayor. I will be supporting the budget, as I mentioned. I think we set ourselves up here for the future. And to get to that, we do have to borrow a bit of money to make this happen. If we don't move forward, this is going to cost more in the long run. That's a very, very important thing. So we're actually doing justice, and we're doing it the right decision. We're setting ourselves up here now because these projects are going to cost more down the road. We have some big things going on by the Comfort Center. We have a lot. There's a lot of plans. There's a big picture here from all departments, and this is a balance to make this all work. I think the taxpayer and the community are always been happy with our fiscal responsibility, but also what they see from the dollars that are being spent. And so I'm okay with this. It's I think it's manageable. It's something that could be short term, and I think again the residents would be very happy. Thank you.
Councillor Donovan.
Thank you, Mr. Mayor. I will be supporting the budget that is being put forward for many of the reasons that have been said around this table. It's a requirement that we grow, that we're ready for future growth, as the town seems to be on a great trajectory for future growth and new individuals moving into our town. So I think it's important that we control the amount of debt, certainly, that we're looking at. And I think we've put enough time and thought into the projects that will be financed through this process, and that moving forward, we'll be able to assure the quality of life here in Petawawa.
Thank you. Councillor Kernahan.
Thank you, Mayor Service. I'll just restate this. I said this on budget day, but debt is like a drug. And once you get addicted to that, there's no turning back. And I am very cautious about this, about debt. I'm very debt averse because I feel that moving forward, it's going to be very difficult to not go into debt when we've already committed a couple of percentage points of a tax increase to servicing that debt in future years.
Thank you. Further questions or comments? Okay, so a budget is never an easy thing to do, and I think we've taken a lot of time and a lot of thought together, along with the leadership team and all of the staff, to come up with a budget that I think is responsible. I know it's never pleasant or popular to raise taxes, but I think sometimes in order to provide the services you need for your community and to keep up with infrastructure needs and to plan for the future, sometimes, as unpopular as it may be, it's a necessity. And Deputy Mayor Sabern makes a good point. We have been historically low in tax increases, and I know people don't like when we compare ourselves to other communities, but a $500,000 home here in Petawawa is approximately $5,000 in municipal taxes. And in other communities, which I will not name, it is double. And so we are in a bit of a position where we don't have as much industrial tax base and commercial tax base as some of our neighbors. So a lot of the revenue that we need to generate is borne by our residents and municipal taxes, which is unfortunate. So we have set a 6.54 tax increase, which is 6.52, which again is not popular, but it's a necessity to get us to where we need to be. On the question of debt, historically, Petawawa has been a town that hasn't done a lot of debt financing. I made one good point about the waste recovery center as an example of us, along with some other municipalities, went into debt, but it was something that was much needed in this county. And it's still serving us well in this county. And I think it was just last year that 2 years ago that we made our last debt financing payment on that facility. And it is still serving us well. So when we look at what we're proposing to debt finance, I know it's not popular to debt finance a road and a vehicle. The building last year was something that, you hope will last 50, 75 years. A road and a vehicle is not going to last that long. But as Councillor Coutu said, when we look at what we need for our community now, we can't afford everything right now unless we go into some debt financing. Traditionally in the past, we have set aside money, and sometimes it takes years and years before you can build that infrastructure, build that road, purchase that vehicle. And as Councillor Roots mentioned, often 5 or 10 years down the road, that is way more expensive than it would have been if you do it now. So it's not a very comfortable position, and we don't take very lightly that we're using taxpayer money to go into debt financing. But again, as we sat around this table with members of council, staff, leadership team, we looked at what this town needs now and what the future needs are for this town. And we have decided that it's not a little bit of debt, and a responsible way to repay that debt is something that will serve the interests of this town moving forward. So that's where we are now, and we're at the moment here where we have to decide if the 2026 budget that we've worked on for quite some time now, that if we're comfortable moving this forward. I think I already got the motion in the second. Okay, so we're going to do a recorded vote, so I'll turn it over to the clerk.
Thank you. So it was moved by Councillor Donovan and seconded by Deputy Mayor Teresa Sabrin. And Councillor Carmody is called for a recorded vote. So I'm going to be asking if you're voting for or against the motion. And we'll start with the requester, Councillor Carmody.
Against.
Counselor Coutu?
For.
Counselor Driscoll?
Against.
Counselor Donovan?
For.
Counselor Reeves?
For.
Mayor Service?
For.
And Deputy Mayor Sabri?
For.
And honestly, so I had to do this. Corporation of the Town of Petawawa bylaw 181426, being a bylaw.
Would I just say it's carried?
Call for the, call for the vote. It's would be carried, 5 to 2.
So you want me to send it? Okay. A recorded vote was called for, and it was carried 5 votes to 2 votes.
Okay, now we're back on track. Thank you. As a corporation of the Town of Petawawa bylaw 181426, being a bylaw to adopt estimates of all sums required for municipal water and wastewater purposes for the 2026 fiscal year, be read at their time and pass. This constitutes third and final reading of bylaw 181426, the second day of March 2026, which was carried 5 to 2.
Okay, thank you, everybody. That was a good discussion. Next, we have bylaw 1815/26, being a bylaw to amend bylaw 1780/25. Being a bylaw to authorize the execution of a transfer payment agreement to receive funding under the Mental Health Supports for Public Safety Personal Grant Program with His Majesty the King in right of Ontario as represented by the Solicitor General. I need a motion for first and second reading. Moved by Councillor Roots, seconded by Councillor Coutu, that bylaw 1815/26, being a bylaw to amend bylaw 1780/25, being a bylaw to authorize the execution of a transfer payment agreement to receive funding under the Mental Health Supports for Public Safety Personnel Grant Program with His Majesty the King in right of Ontario as represented by the Solicitor General, be read a first and second time. I'll call for the vote. All in favor? It's carried.
Corporation of the Town of Petawawa bylaw 1815/26, being a bylaw to amend bylaw 1780/25, being a bylaw to authorize the execution of a transfer payment agreement to receive funding under the Mental Health Supports for Public Safety Personnel Grant Program with His Majesty the King in right of Ontario as represented by the Solicitor General. Be read a first and second time the second day of March 2026.
I need a motion for third and final reading of bylaw 1815/26. Moved by Deputy Mayor Sabrin, seconded by Councillor Carmody, that bylaw 1815/26 be read a third and final time and passed. Just for everyone's information, that's a grant from the government for mental health supports for volunteer fire department. I'll call for the vote. All in favor? It's carried. Next, we have bylaw 1816/26, being the bylaw. Oh, I forgot to let you know. I was rolling.
Corporation of the Town of Petawawa bylaw 1815/26, being a bylaw to amend bylaw 1780/25, being a bylaw to authorize the execution of a transfer payment agreement to receive funding under the Mental Health Supports for Public Safety Personnel Grant Program with His Majesty the King in right of Ontario as represented by the Solicitor General. Be read at their time and pass. This constitutes third and final reading of bylaw 1815/26, the second day of March 2026. And part of the amendment was that they've extended the length of time for us to spend the money for the grant.
Okay, next we have bylaw 1816/26, being a bylaw to adopt the election-related resources policy for the 2026 municipal election. I need a motion for first and second reading. Moved by Councillor Donovan, seconded by Councillor Driscoll, that bylaw 1816/26, being a bylaw to adopt the election-related resources policy for the 2026 municipal election be read a first and second time. I'll call for the vote. All in favor? It's carried.
Corporation of the Town of Petawawa bylaw 1816/26, being a bylaw to adopt the election-related resources policy for the 2026 municipal election Be read first and second time this second day of March 2026.
I need a motion for third and final reading of bylaw 1816/26. Moved by Councillor Carmody, seconded by Councillor Roots, that bylaw 1816/26 be read a third and final time and passed. Any questions or comments? I'll call for the vote. All in favor? It's carried.
Corporation of the Town of Petawawa, bylaw 1816/20. Thank you. 26 being a bylaw to adopt the election-related resources policy for the 2026 municipal election. Be read a third time and passed. This constitutes third and final reading of bylaw 1816/26, the second day of March 2026.
Next, bylaw 1817/26, being a bylaw to authorize the execution of a reciprocal use of facilities agreement with the Renfrew County District School Board. I need a motion for first and second reading. Moved by Councillor Coutu, seconded by Councillor Carmody, that bylaw 1817/26, being a bylaw to authorize the execution of a reciprocal use of facilities agreement with the Renfrew County District School Board, be read a first and second time. I'll call for the vote. All in favor? It's carried.
Corporation of the Town of Petawawa, bylaw 1817/26, being a bylaw to authorize the execution of a reciprocal use of facilities agreement with the Renfrew County District School Board, be read a first and second time the second day of March 2026.
I need a motion for third and final reading of bylaw 1817/26, moved by Deputy Mayor Sadler, seconded by Councillor Carmody, Councillor Driscoll, that bylaw 1817/26 be read a third and final time and passed. Questions or comments? So as we know, this is our typical use agreement with the Renfrew County District School Board schools here in the town. And it was great to have that amended, which allows us to have use of their facilities and reciprocal use of ours on their behalf. I'll call for the vote. All in favor? It's carried.
Corporation of the Town of Petawawa, bylaw 1817/26, being a bylaw to authorize the execution of a reciprocal use of facilities agreement with the Renfrew County District School Board, be read a third time and passed. This constitutes third and final reading of 1817/26, the second day of March 2026.
Next, we have bylaw 1818/26, being a bylaw to appoint a building inspector, property standards officer, and municipal law enforcement officer for the town of Petawawa. I need a motion for first and second reading. Moved by Deputy Mayor Sabrin, seconded by Councillor Donovan, that bylaw 1818/26, being a bylaw to appoint a building inspector, property standards officer, and municipal law enforcement officer for the town of Petawawa will be read a first and second time. I'll call for the vote. All in favor? It's carried.
Corporation of the Town of Petawawa, bylaw 1818/26, being a bylaw to appoint a building inspector, property standards officer, and municipal law enforcement officer for the town of Petawawa, be read first and second time the second day of March 2026.
I need a motion for third and final reading of bylaw 1818/26. Moved by Councillor Carmody, seconded by Councillor Coutu, that bylaw 1818/26 be read a third and final time and passed. Any questions or comments? I'd like to welcome aboard our newest employee of the town of Petawawa, Ali Tadway, who is our new building inspector. I hope he enjoys his long tenure here with the town of Petawawa. I'll call for the vote. All in favor? It's carried.
Corporation of the Town of Petawawa, bylaw 1818/26, being a bylaw to appoint a building inspector, property standards officer, and municipal law enforcement officer for the town of Petawawa, be read a third time and passed. This constitutes third and final reading of bylaw 1818/26, the second day of March 2026.
And finally, bylaw 1819/26, being a bylaw to authorize the execution of an agreement with the United Food and Commercial Workers Canada Local 175. I need a motion for first and second reading. Moved by Councillor Roots, seconded by Councillor Driscoll, that bylaw 1819/26, being a bylaw to authorize the execution of an agreement with United Food and Commercial Workers Canada, Local 175, be read a first and second time. I'll call for the vote. All in favor? That's carried.
Preparation of the Town of Petawawa bylaw 1819-26, being a bylaw to authorize the execution of an agreement with the United Food and Commercial Workers Canada, Local 175, be read first and second time the second day of March 2026.
I need a motion for third and final reading of bylaw 1819/26. Moved by Councillor Carmody, seconded by Councillor Coutu, that bylaw 1819/26 be read a third and final time and passed. Any questions or comments? Just let everybody know that that's our agreement with our volunteer fire department. Thanks to the CAO and Jody of the HR for all their negotiating work on that one. I'll call for the vote. All in favor? It's carried.
Preparation of the Town of Petawawa bylaw 1819-26, being a bylaw to authorize the execution of an agreement with the United Food and Commercial Workers Canada, Local 175, be read a third time and pass. This constitutes third and final reading of bylaw 1819-26, the second day of March 2026.
Okay, we have no correspondence. We do have some minutes to pass. Council and committee meeting minutes of February 23rd, 2026. I need a motion to accept those minutes. Moved by Councillor Roots, seconded by Councillor Coutu, that the minutes of the council and committee meeting held on February 23rd, 2026 be accepted by council, and that resolutions from that committee become resolutions of council. Any questions, comments on the minutes? I'll call for the vote. All in favor? It's carried. Next, we have minutes of the Petawawa Accessibility Advisory Committee meeting of November 27th, 2025. I need a motion to accept those minutes. Moved by Councillor Donovan, seconded by Councillor Coutu, that the minutes of the Petawawa Accessibility Advisory Committee meeting held on November 27th, 2025 be adopted as information. Councillor Donovan.
Thank you, Mr. Mayor. I know I spoke to most of these items in previous council reports. We were just heading into our Christmas events at the time, just prior to our Central Santa event. So I'm happy to answer any questions anyone has. We've set our schedule for 2026. We've got some goals set aside as and identified, and yeah, happy to answer your questions.
Questions on the minutes? Seeing none, I'll call for the vote. All in favor? It's carried. Next, we have minutes of the Petawawa Seniors Advisory Committee meeting of January 7th, 2026. I need a motion to accept those minutes. Moved by Deputy Mayor Sanverin, seconded by Councillor Carmody, that the minutes of the Petawawa Seniors Advisory Committee meeting held on January 7th, 2026 be adopted as information. Deputy Mayor Sanverin.
Thank you, Mr. Mayor. I'm glad to see that the budget was passed tonight, because now we can get our seniors guide out and available for print. It's been a year-long effort by members of the Seniors Advisory Committee. The other thing that I had reported on when I talked about these meeting minutes was the 2026 goals that we have established as a committee. So I'll just take a few moments to lead you through them. The first goal is enhancing opportunities for seniors through the development of a series of offerings. Various opportunities, try it, giving participants a chance to try something new. We'll be looking at lunch and learns, addressing a specific topic, allowing for discussion, questions and answers while enjoying a local food. Active, expanding upon group activities both locally and out of the area, and support, providing group opportunities for psycho-educational and or emotional support. The second goal is the developing of a seniors parquet. We're going to facilitate community and stakeholder engagement to generate ideas, broad concepts, and support. Develop a plan which includes resources and budget over a multi-year period for council's consideration. Include physical and mind sport activities, passive and active opportunities, social and cultural contexts. We're going to explore partnerships and collaborations. The third goal is conducting outreach. By increasing the participation of our seniors in decision-making, steps will include connecting seniors to resources, services, and programming, reducing isolation, addressing barriers to engagement, improving participation in programs and services, building intergenerational connections. The fourth goal is promoting volunteerism. by addressing the benefits of volunteering, such as improved physical and mental health, social connection, reduction of isolation, developing a sense of purpose, meaning, and as well as cognitive stimulation. We plan to research and develop a resource of volunteer opportunities for seniors in our community. There are lots of opportunities, but people don't necessarily know where to start or how to make that connection. So we plan to support that. And last, and certainly not least, is the celebration of our second annual National Seniors Day. So this is a Save the Date event on October the 1st. And building on the momentum of our first event in 2025, we've taken the feedback of our participants and plan to make our second annual event one that addresses more of the realities of our aging population through education, interaction, fun, and food. And so it'll be a very ambitious year for this very keen and hardworking group. And we're excited to start the momentum on that. So thank you, everybody.
Questions on the minutes? Councillor.
Thank you, Mr. Mayor. Just a comment. Great work. If you can achieve that, that's wonderful. Those are a lot of good initiatives for seniors and so important out there today to get there and keep our seniors involved. Thank you.
Thank you very much.
Further questions or comments? Yeah, I'd just like to say that's a very ambitious list of goals. Building on your wildly successful 2025 year. All I hear is positive feedback on the new senior center, the advisory committee, everything that we have going on for seniors there. So we're looking forward to another amazing 2026. I'll call for the vote. All in favor? It's carried. Next, we have minutes of the Petawawa OPP Detachment Board meeting of January 28, 2026. I need a motion to accept those minutes. Moved by Councillor Carmody, seconded by Deputy Mayor Sabrick, that the minutes of the Petawawa OPP Detachment Board meeting held on January 28, 2026 be adopted as information. Councillor King.
Thank you, Mayor Service. So these minutes are from our meeting on January 28th, at which I was elected board chair for the remainder of the term. So it was a lot of business as usual. However, we did establish a set of goals for 2026. So, of course, not to be outdone by the deputy mayor, I'm going to have to read them off. So we had a list of 4 goals that we settled on. We trimmed our list of goals significantly down to a more manageable size. And so those goals for 2026 are to promote the role of the Petawawa OPP Detachment Board in our community by participating in social media messaging, attending the annual showcase event, supporting the RIDE program, and the CamSafe program, among other strategies. Goal number 2 was to establish and maintain partnerships with local advisory and community groups to promote a safety network for children, youth, families, and seniors. Our 3rd goal was to maintain an active educational program that addresses speeding, distracted driving, and impaired driving. And if you listen to 104.9, you will hear one of our PSAs in the not too distant future regarding speeding. Goal number 4 was board members to ensure their commitment to their role with the Petawawa OPP Detachment Board through continued participation in educational and training opportunities offered through the Ontario Association of Police Services Board and the Ontario Police College. So that was our list of goals. And one other thing of note that you may have noticed in here is a request for questions, interview questions. So next Monday, interviews for the new detachment commander of the Upper Ottawa Valley OPP will be held here in our boardroom starting at 10 a.m. and I will be participating in that process. So we will have a new detachment commander before too long. Thank you.
Questions on the report for the minutes? No questions? Well, congratulations to the OPP Detachment Board on your list of ambitious goals. And thanks for all the work you do with your oversight and your work on helping to keep our community safe. That's great. Are you allowed to say how many candidates you have, or is that top secret?
Top secret.
Well, we'll be looking forward to the results of your interview day and looking forward to our new detachment commander. I'll call, and congratulations on being elected board chair once again, Councillor Kermany. I'll call for the vote. All in favor? It's carried. We have no staff reports, so we'll go right into councillor reports. Deputy Mayor Saffron.
Thank you, Mr. Mayor. On February the 18th, I participated, pardon me, in a police services detachment board meeting. On the 19th, I attended a webinar on municipal government, and in particular on running for office. And I would like to strongly encourage anyone who maybe considers running for office to become a municipal councillor or potentially mayor to take advantage of the opportunities that are being offered through the Association of Municipalities of Ontario office. They have a number of webinars as well as a ton of resources to guide you through the process, to give you answers to questions you may have, to help you think in the municipal context. And certainly there's been a lot of time, energy, and expertise. And so I would encourage folks to take advantage of that. On the 23rd of February, I chaired a library board meeting. On the 25th of February, I participated in the Equity, Diversity, and Inclusion meeting. I know Councillor Patu will give you a more fulsome update. On the 26th, I was privileged to be able to go to Canadian Nuclear Laboratories to participate in a photo opportunity for the Water and Dirt Festival, as CNL is the premier event sponsor. So thanks very much to CNL and to all the other sponsors for getting behind this absolutely wonderful annual event. Thank you, Mr. Mayor.
Thank you, Councillor Kermany.
Thank you, Mayor Service. On February 18th, I chaired a meeting with the OPP Detachment Board, Petawawa OPP Detachment Board, and that is it for my report today.
Thank you, Councillor Patu.
Thank you, Mayor Service. On February 23rd, I participated in a Petawawa Public Library board meeting. And on February 25th, I chaired a meeting of Petawawa's Equity, Diversity, and Inclusion Advisory Committee. And highlights from that meeting, in particular, at this meeting, we finalized and approved a draft municipal inclusion charter that I'm very excited to be bringing forward to council to review and consider. And it's a mix of a statement of principles and some parameters for taking action to create a Petawawa that's, equitable, inclusive, and diverse. So very excited to bring that forward. And as well, we just moved forward on some more planning for Pride 2026, and then hopefully bring some more interesting projects forward soon. So any questions you have, let me know.
Thank you. Councillor Driscoll.
Thank you, Mr. Mayor. On February 19th, I moved to part in an airport meeting. We discussed our year in review brochure, which will be out soon. We passed our budget, and the finances are very healthy with an increased revenue year over year again. We are upgrading to LED lights in terminal building, maintenance buildings, and another hangar. And there's hopefully some big things to come for 2026. So stay tuned for that. And that will be it. Thank you.
Thank you, Councillor Gunn.
Thank you, Mr. Mayor. On the 4th and 5th of February, I sat in with the transportation feasibility study for 2 different groups at that time. On the 4th of February, I was a part of the subcommittee through the Seniors Advisory Committee with regards to senior volunteering. We did our meeting in preparation of our work statement at that time. The grand opening of the Neuro Unique service that was held on that great Saturday morning, was able to attend that. We did a photo session for our seniors activities committee, which will be put into our now finally set and ready to go guide that we will be sending out. I participated in the budget session with council, staff, senior leadership on the 12th of February. On the 25th of February, I sat in on the Stronger Leaders, Stronger Communities online workshop that was held. by AMO, or the Association of Municipalities of Ontario, which had some great information in terms of running for municipal government and how to determine what your interests might be and how you bring that to life through your involvement in municipal council. And that's it.
Thank you, Councillor Roots.
Thank you, Mr. Mayor. February 19th, I also attended that same airport commission meeting. Also, the board elections were held, and Alan Wren was nominated again for chair. I was nominated for vice chair, and Councillor Briscoe on the executive committee. Also, the new enhanced lighting for Festival Hall was installed and tested last week. This is another great update to this facility. Best part about this whole project that we're right on budget. Sometimes when you start opening up lighting, doing a changeover of this magnitude, you never know what type of things you could run into with all sorts of wiring, electrical connections, but everything went really, really good. What this lighting package does, there's now no more dark spaces on the stage. So it's full coverage now. So if you have an act, it's a big act, it could be the symphony, it could be a play, there's no dark spots. The whole stage is now will have lighting and soft lighting, lighting that makes things very comfortable, pleasant to look at, all LED. So it's a really good enhancement. Also, this now sets up our next phase will be the large TV monitors, which will be installed on both sides of the stage and also in the main lobby, as I mentioned prior. You'll be able to now see if you're in the lobby what is going on in the theater, or there could be also announcements or advertisements put up as well. So this is the next phase. So things are moving forward. We have there's actually not enough weekends in the year that the hall is now really, really booking up. So things are going well, but that's just the latest update on that project.
Exciting things at Festival Hall. Okay, on the 17th, I was a judge at the Valor Grade 7 and 8 speech contest, and I have great faith in the young people of today. There was 27 youth who gave speeches, and they were really very impressive. So it's good to see. On the 19th, we had another round canopy parachute meeting at the airport in terms of an exciting event that we may get here in May. Also on the 19th, we had our initial transit meeting with the city of Pembroke. So the treasurer of Pembroke came up to visit us, and we talked about possible collaborations and cooperations with the Ottawa Valley Transit System, possibly coming to Petawawa a few times a day to make runs. But we'll wait until we get the results of our public transit study, and then we'll sit down with Pembroke again and see what kind of deal we can hammer out. On the 23rd, the CAO and I and Colin Foyle went up and had a recreation meeting with the Garrison leadership team. Great strides were made up there in terms of cooperation and sharing of schedules and possible future collaborations with the Garrison in terms of all things recreation. Hopefully some more to come from that soon. That same day, I also had a meeting with some of the staff from Parks Ontario regarding Petawawa Terrace Park and the potential expansion of the parking lot there. There's a few hurdles to overcome still, but it's looking positive that maybe someday soon we might get an expansion of that parking lot, which will be good for everybody who uses it. On the 25th, there was the County Development and Property and Operations meeting. I'll talk more about that later. 26th, I was the MC for the Renfrew County Elementary Trivia Contest at Valor. The winners were Valor for the first time that I can remember in a long time. Also that evening, there was a LCC meeting for the Ottawa Valley Forestry, and I'll have more of a report on that sometime later. On the 27th was the student teacher hockey game at Valor for a fundraiser for cancer, and the teachers won, and I didn't injure myself, but that was good. Also on that day, I'd like to thank CAO Colin for attending on my behalf the big Highway 17 announcement down in Renfrew. You want to comment on? No,
That means we said already.
Yeah. And today I had a meeting at Renfrew County. It was the county liaison with the city of Pembroke meeting. Some of the interesting points that came out of that, they gave us an update on the Mesa and the Heart Hub. So now the intake, or what's called the intake center now, it used to be the warming center. It's now part of the Heart Hub. And they reconfigured it, you can fit 29 people in there maximum. And they've had an average of 21 every day all winter using that facility. So in a way, it's good to see it's being used, and in a way, it's not good, but at least it's serving the purpose for those who require it. At the McKay Street, they call it transitional bridge housing, which was just, ribbon was just cut. As I said before, there's 12 rooms, 11 of them are occupied right now, and they're 1 month away from finishing the renovations on the 8 rooms on the 2nd floor. So there'll be 8 new transitional bridge units available to those who need it. And that is all working in conjunction with, they have some other transitional housing. Columbus House, Youth Hub, there's some crisis beds at the Pembroke Regional Hospital. Most of those are only available for shorter stays. And then the goal is, or the strategy is to, once the individuals leave those facilities, is to get them into the transitional bridge housing. They can actually stay in those units for up to 2 years while they get the help and assistance they need to get out there into the working world and into a place of their own. The other thing you might find interesting, Pembroke presented its budget and the county presented its budget at this meeting in terms of how they're intertwined. What I learned today is that, as we know, Pembroke is not a member of Brantford County. They're a city unto their own, but they still contribute financially to the county for Ontario Works. And what I learned today is that is the formula for that is 80% is weighted assessment from the city of Pembroke, and the other 20% is actual caseload of residents of the city of Pembroke. So that's how they determine how much financial outlay is given for Ontario Works. Paramedics, they calculate it using a formula, and it's based on population. So Pembroke's population, they put it into the formula, and that's how much they pay financially for paramedics. Childcare payment is calculated on weighted assessment, and long-term care homes, it's based on the number of residents that you have from your municipality in the facility. So for Pembroke, and the way they work it is you must have lived in the city of Pembroke for a 10-year period before you enter the long-term care home. And then that individual counts as your towards the formula. And right now, Pembroke is paying 30% of all long-term care costs based on their residents that are. Yeah, I thought that was kind of interesting. At the county meetings, we learned that the Eganville Leader has been sold and will continue to operate, which is good news for the entire area. Ray Stanton and John Houston, 2 individuals from the London area, have purchased the paper and going to keep it going. So that's good. We had a report on Algonquin Trail enforcement. So Protect 5, or the enforcement agency that's been out on the trail. And for 2025, they did 93 focused patrols. I forgot to record the number of hours, but they issued 10 fines. And one of the recommendations that came out of the whole report was that it's probably going to be a good idea to get these individuals a radar gun, because they witness a lot of speeding and all they can do is give warnings based on their visual. The 2026 Capital Works Program was handed out at the operations meeting at the county. $30 million being spent, redoing 48.64 kilometers of roadways. The only one really that pertains to us is they're doing Dorn Road from Highway 17 to Forest Lee Road. So there's about 100 meters of road in Petawawa there on the Dorn Road, but it's being completely resurfaced and 1 meter shoulders put in there. 9.8 kilometers of Algonquin Trail are going to be stone dusted, resurfaced, and they're also replacing 3 bridges on the trails. So that'll take them all the way up to the Deux Rivières train crossing. And what they've decided up there is the existing trestle bridge will not be refurbished. It's just too costly. So they're actually going to put a detour across the highway and around and back up onto the railway. The old CN rail line all the way from Algonquin Park to the Ottawa River is in negotiations right now for the county to assume ownership of that. And then eventually in the future, that may be stone dusted, that entire distance as well. So it'll really tie in the whole county. The transportation master plan was looked at again, but not passed. They decided we're gonna put together a little working group and look over the transportation master plan again, which is good news for us. We can maybe encourage more of our roadways to get on the plan. Greg Belmore was appointed deputy treasurer. They talked about the Buy Ontario Act, and some very serious concerns were brought forward about the Buy Ontario Act that is being proposed by the Ontario government in terms of, will this restrict too much what you can buy and where you can buy it from? And will it eventually just result in increased costs because you're not allowed to source the cheapest option? And in the health report, a new program called Wayfinder, and it's all part of the Mesa and the Heart Hub. And it's a new and a more efficient way to identify and access supports more quickly for people who are experiencing substance abuse and mental health issues. It's just a streamlined way for them to find the supports they need, and it looks pretty good. Okay, that's it. Confirming there's no closed meeting, so I need a motion for the confirming bylaw. Moved by Deputy Mayor Sabrin, seconded by Councillor Carmody, that bylaw 1820/26 be read a first, second, and third time and passed. I'll call for the vote. All in favor? It's carried.
Corporation of the Town of Petawawa bylaw 1820/26, being a bylaw to confirm the proceedings of council at its meeting held on March 2nd, 2026, be read a first, second, and third time and passed. This constitutes first, second, and third reading short of bylaw 1820/26, the second day of March 2026.
I need a motion to adjourn. Moved by Councillor Coutu, seconded by Councillor Donovan, that the meeting adjourn to the call of the mayor. I'll call for the vote. All in favor? It's carried.